Hi, this is my poster presentation on the evaluation of changes to access to care during the pandemic for the population over the age of 65. Reduction in access to healthcare during COVID-19 remains an area of in-depth investigation. The analysis main points center on the understanding of the effects on other care users, including the elderly and people with chronic illnesses. Access to healthcare has changed because of navigating the challenges of lockdowns and staying at home, which calls for significant investigation. This research aims to investigate the reduction in individual access to care based on age. Sustainability and service delivery during a pandemic requires addressing the immediate individual needs for all healthcare access. COVID-19 has affected different sectors and regions globally. Discovered in December 2019, the virus rapidly spread from China to other regions until it was declared an emergency by the end of January 2020. One significant effect of globalization is the spread of the disease because advanced air travel led to people flying from one country to another with the virus. With time, the impact of the pandemic had been felt worldwide, spanning from transport, tourism, and trade, as countries were advised to issue temporary lockdowns to prevent further international travel. Methods and results. The National Center for Health Statistics used the Research and Development Survey RANDS platform to conduct a survey in 3 phases to confirm its accuracy and dependability and assessing changes in healthcare access. The first period being RANDS 1 ran from June 9th, 2020 until July 2nd, 2020. The second period being RANDS 2 ran from August 3rd, 2020 through August 20th, 2020. And the third period being RANDS 3 ran from May 17th, 2021 until June 30th, 2021. The data compared in rounds 1 and 2 and 2 and 3 are in the appendix section. The two categorical data groups were downloaded from RANDS. The population of the study was the age group 65 years and older, and the focus was how many of those individuals experienced reduced access to care. The categories were assessed in 3 different periods, RANDS 1, RANDS 2, and RANDS 3. In RANDS rounds 1, 2, and 3, the age of those who had reduced access to care were 1,805, 1,682, and 1,744 respectively. Then the 3 categories were compared to see if they were statistically significant according to the hypothesis presented in the study. Using RStudio for rounds of the survey, it was calculated using the RANDS data if the age group of 65 or older is statistically significant. To calculate how many people have reduced access to care, it was determined that 39% of 1,805 people, or 704, were involved. The second group was made of 437 out of the 1,682 people who had reduced access to care, or 26% of people. The third group was made of 9% of the 1,744 individuals with reduced access to care. The chi-square p-value output from RStudio was calculated using an internet calculator, and it was found to be less than 0.00001 for RANDS rounds 1 and 2, as well as RANDS rounds 2 and 3. Conclusions. COVID-19 led to considerable change in healthcare sectors, especially in accessibility to service among people with ongoing conditions requiring checkups and navigating the racial health disparity. Accordingly, the paper aims to determine the reduced access to care that COVID-19 brought about to the various patients to understand its implications on the care dynamics. Contemporary research acknowledges that COVID-19 led to a change in the provision of the non-essential services, upholding necessary care requirements, assessment of the disparities between pre and during the pandemic period. The pandemic and the subsequent lockdown hampered routine care delivery across healthcare facilities, with the focus of the research on diverse facets such as chronic conditions, ongoing maintenance, and education. It is apparent that the pandemic directly impacted accessibility to health services. Thank you, and that concludes my evaluation of changes to access to care during the pandemic for the population over 65